Lymphatic drainage massage is an important strategy for lymphedema maintenance. And when combined with compression garment use, exercise, and skin care, better outcomes are seen when it comes to complications associated with the progression of lymphedema, such as fibrosis, increases in limb size, and infection. It's always a good idea to check with your health professional if in doubt, but in this video, I'll explain when you should do your lymphatic drainage and when you should skip it. So when people ask me, how often do you do self-lymphatic massage for your arm lymphedema? I find this question can get tricky because when I first graduated from training many, many years ago, I was told that self-lymphatic massage should be done daily, regardless. But over the years, I've realized that for many, this just isn't feasible. And it usually leads to people just not doing it at all. So now when I get asked how often should I do my self-lymphatic drainage massage, I tell people it depends. The one thing that you need to remember is that fluid accumulation and removal from the body's tissues is always fluctuating. What you may need for self-massage one day may not be what you need in a few days, weeks, or even months from now. So lymphatic drainage should be tailored to your unique situation in the moment. So you may assess daily, but you may not be doing your self-massage daily. So these are some of the things that I suggest for people. Definitely, if you're in the intensive phase of treatment, which means you've just had your diagnosis, you are reducing the size of your arm through compression on a 23 to 24 hours basis, definitely doing the daily lymphatic drainage massage daily is going to help. If you are in the maintenance phase, but you want to reduce your arm, so you're going to enter back into your intensive phase for a bit before you get a new garment, I would suggest doing daily lymphatic drainage massage then. If you are finding that maybe the weather is hot and humid, or you're traveling, or you've had a little extra salt the day before and you're feeling a little swollen, that would be a good day to do your lymphatic drainage massage as well. And I call those trigger days. If you have moderate to severe swelling, I would suggest you do it daily. Your lymphatic system needs that extra help. Also, if you have moderate swelling and an active lifestyle, but have trouble spots or congested areas, such as the areas that I mentioned in my other videos, then I also would suggest that you do it daily. If you have an active lifestyle, however, and by active lifestyle, I mean that you are involved in an exercise program 3 to 4 times a week, then you might get away with doing your lymph drainage every second day. When you're in the maintenance phase and you have mild swelling and an active lifestyle, you might be able to get away with doing your lymphatic drainage for yourself 3 times a week, say. Again, this is all based on your self-assessment and how your arm is doing that day. When people ask me when to do their lymphatic drainage massage, I always suggest perhaps just before bedtime, making it a part of your bedtime routine. A lot of people like doing it that way because that's when they have the time for themselves. Now, there are times when you should stop doing your self-lymphatic drainage massage, and there are times that you need to avoid some areas, but you can still go around or do other things like deep breathing and self-exercise in order to improve and aid lymph flow. So, if you have an infection in the swollen tissue, any new or sudden swelling in your arm or chest, or a known blood clot in your arm, neck, or on the side of your swollen arm, you need to discontinue your self-lymphatic massage and wait until your medical team gives you clearance. If you have a sunburn in your swollen arm, just give it a few days rest before you begin again. During radiation therapy, do not do any hands-on over the radiated field. You can still do other things, such as massaging your arm if it's not involved in the radiation field, doing deep breathing, and gentle exercises that your oncology team has given the okay for. Lymphatic drainage massage is a gentle technique overall, but if you have skin that tears easy, use caution with any deeper edema techniques that you are using. Thank you for watching today. This video is part of my Work Smarter, Not Harder video playlist. Please like and subscribe and share so others can see it too. And head over and see the other videos I have on self-massage and self-arm assessment in the Work Smarter, Not Harder video. I'll see you in the next one.